Hello and a very good afternoon to all our viewers on Facebook as well as YouTube for this live interaction of News 9. Well, today I will be speaking about vaccine nationalism and how the WHO has come up with a plan to curb vaccine nationalism, and also the impact of vaccine nationalism on some of the most smallest countries who wouldn't have access to vaccine if this particular concept materializes across the world. So even before the final stage of the regulatory approval of vaccines, some of the most wealthiest nations like the US, UK, France, Britain and even Germany have entered into pre-purchase agreements with COVID-19 vaccine manufacturers, and this particular development has given rise to what has come to be known as vaccine nationalism, which I mentioned about earlier. And now with the debate continuing to rage, there are fears that the agreements could make the initial few vaccine unaffordable and also inaccessible to everyone apart from the rich countries. So the World Health Organization on Monday said some 172 countries are engaging with the COVAX facility designed to ensure equitable access to COVID-19 vaccines. But more funding is also needed and countries need to make binding commitments, is what the WHO said. And earlier, it had urged countries to join a global pact aimed at ensuring less wealthy countries have access to COVID-19 vaccines, warning about the kind of risks from the so-called vaccine nationalism. So, the WHO Director Tedros has said initially, when there will be limited supply of COVID-19 vaccines, it's important to provide the vaccine to those at the highest risk around the globe. He also said that the high-risk group included the health workers who are working on the front line of this pandemic and who are critical to saving lives and also stabilizing the overall health system. So now, in order to answer some of the questions that are surrounding vaccine nationalism, we have with us Dr. Sitesh Roy from Mumbai, who is a very renowned immunologist. Very warm welcome to you, Dr. Sitesh Roy. And today the debate is all about vaccine nationalism. So what is vaccine nationalism and how dangerous do you think it will be if it materializes, Doctor?
So vaccine nationalism, Deepak, is a classic example of where a person wants to take care of their own home before worrying about everyone else around them. And what's basically happening is, as the race to getting an effective vaccine gets closer and closer, and there are more and more possibly successful candidate vaccines completing their phase 3 trials in the next month or so, many of the, as you said, well-to-do countries have come into direct associations, what are called bilateral agreements, with some of the vaccine manufacturers like Pfizer, GSK, Sanofi, Moderna, to make sure that their population, their country and their citizens get the vaccine before the rest of the world. And in doing so, they are basically ensuring that they get the maximum chunk or the bulk of what is made of these vaccines for their own people's use. In doing so, there is something called a Global Alliance for Vaccination and Immunization, GAVI, which along with WHO has formed a coalition called COVAX, through which they hope to be able to distribute the vaccine in an equitable manner to 150 countries around the world. And in doing so, it would be a more smart way to vaccinate many people in many places together rather than getting them vaccinated in one place. And that's where the whole concept of vaccine nationalism, where some countries are trying to protect their population, like China, Russia, US, Britain, and the European Union, are coming in. So that, in short, Deepak, is vaccine nationalism for you.
And also, Dr. Sitesh, do you think that vaccine nationalism could slow the fight against COVID-19? Dr. Sitesh Roy?
Well, I wasn't able to hear you, Deepak. I'm getting a lot of disturbance on the line. There are other people speaking.
Okay, Dr. Sitesh Roy, now can you hear me?
Yes, I can hear you loud and clear now.
Yeah, Dr. Sitesh, all I was asking you is, how do you think this vaccine nationalism could, slow our fight against COVID-19?
So the issue here, Deepak, as you can imagine, is this virus has not looked at race, gender, class, country borders, or any of those things, where it has spread like wildfire across the globe, affecting almost 200 countries. And if the vaccination protocols and the vaccination programs are not also done in a universal manner, in an equitable manner across those countries, starting affected and then going to the ones that are less affected, then we will never win the battle against this COVID-19 virus, SARS-CoV-2. And so it is very, very important to have equitable distribution and not have just pockets or individual countries that have gotten vaccinated and then a large part of what may be still cases around the world going unvaccinated and going unprotected. So it's better to have 10 or 20% of the population across the globe to be vaccinated together rather than have 100% in pockets vaccinated, because that's not how you break the cycle or the chain of the spread of the virus. And so that is why vaccine nationalism would affect our ultimate goal and our ultimate purpose of trying to prevent the spread of COVID-19 virus so widely and so extensively across the entire globe to over 200 countries.
And also, Dr. Sitesh, now if vaccine nationalism, realizes, do you think that this could block the vaccine from vulnerable populations?
Certainly. So when we think of vulnerable populations, as we've spoken before, it's always the doctors, the nurses, the society caregivers, the security staff, the people who are at the front line of facing maximum chances of getting the. And in vaccine nationalism, as we can expect, because even the basic of the general population, they're even trying to make the vaccine free of cost to everyone in the United States of America. So, the regular people there getting it, whereas doctors and nurses in other countries not getting it, certainly it would affect the way our frontline and our key workers around the globe in different countries who really need protection so that they can then take care of the people who are still getting sick would get affected. And so certainly that is one of the issues that we would see if vaccine nationalism comes into play.
Also, doctor, like they say, an orchestra cannot be held with one or two instruments being played. So in order to ensure that vaccine nationalism doesn't materialize, do you think that the countries going forward should, sign this COVAX pact with the World Health Organization?
I think it would really help. I think there are about 150 countries on the COVAX pact with the WHO. And as we have more, so if in those 150 countries, the countries that we would consider to be the wealthiest nations like US, UK, China, Russia are not on that, or France and Germany are not on that COVAX pact, it makes the pact weaker. So certainly the more and more countries that are signed up in the COVAX pact with the WHO and the Gavi alliance, I think it would make the whole process of equitable, uniform distribution of the vaccine, of COVID-19 vaccines, whenever they happen, in a better and a more effective way to break the chain and cycle of this virus affecting people around the globe and affecting healthcare workers and other professionals around the world.
Right, Dr. Sitesh, thank you for your time and patience. You're a busy man. You are out there treating COVID-19 patients. We hope that you stay safe. And also, now moving on, like we told you about the COVAX plan by the WHO, it has now come up with this plan which 172 countries have signed a pact with the COVAX facility. So what is this plan and how is the WHO planning to go about it? Well, the COVAX Global Vaccine Facility is a plan designed to pool funds from wealthier countries and non-profits to develop a COVID-19 vaccine and distribute it equitably around the world. And its aim is to deliver close to 2 billion doses of effective approved COVID-19 vaccines by the end of 2021. And this plan is led by the World Health Organization along with the Gavi Vaccine Alliance and the Coalition for Epidemic Preparedness Innovations. So COVAX is part of a bigger plan called the Access to COVID-19 Tools, or the ACT accelerator, that works to ensure that vaccines, treatments and diagnostic tests and other healthcare resources are broadly available to combat COVID-19 pandemic. And the World Health Organization officials also said that nations wishing to be part of the global COVAX plan have until August 31st to submit their expressions of interest with confirmation of intention to join due by September 18th and initial payments due by October 9th. So the World Health Organization is clear with its latest announcement that the countries must sign this pact in order to ensure that vaccines and also treatments are equitably available to people across the globe, irrespective of whether they are rich or poor or based on caste, creed or any other such barriers. So World Health Organization is making sure that everybody gets their share of the vaccine because each life matters, and World Health Organization with its new COVAX facility pact is ensuring that every country gets it. So in order to ensure that the entire population is cured of COVID-19 or to break the chain of COVID-19, each and every individual must be made available for the vaccine, and vaccine nationalism wouldn't help us in any way going forward in our fight against COVID-19. So in order to break the chain, we should make sure that the entire population gets the vaccine, and only then it will be possible for us to break the chain. So with that, it's a wrap on this live interaction, guys. So all I would like to ask you all to do is stay safe and also take all the precautionary measures. We are just another probably 4 to 6 months away from a vaccine, and who knows, we might even get a vaccine before that. But until then, all the safety and precautionary protocols must be adhered to because each life matters and you have to take care of yourself and also the ones around you. Thank you for joining me. Until next time, stay safe.